Hepatitis B and C is a disease that is caused by hepatotrophic viruses. That is, these viruses affect the liver. Namely, they are hepatitis B and hepatitis C viruses.
How can you get hepatitis B and C?
Now, we can get hepatitis B through contact with blood or blood products, or sometimes we do get it from infected semen or body fluids like saliva too. For example, when the blood transfusion is given of infected blood, or the IV drug users, they share needles, syringes and drug sharing equipments, or the tattoos are used and acupuncture needles are used which are infected, or through sharing of razors and toothbrushes with infected individuals, or sometimes it is transmitted by having sex with an infected partner. And in a newborn child, it can be they get infected from an infected mother.
Why is it important to treat hepatitis B and hepatitis C?
It is important to treat hepatitis B and C because if you leave it untreated, the hepatitis B and C viruses, they will attack the liver continuously and they may cause irreparable damage in the form of cirrhosis of liver, liver failure, hepatocellular carcinoma, and this may sometimes even lead to death of the patient.
Who is at risk for hepatitis B or hepatitis C infection?
Now, there are certain risk groups who are more prone to develop hepatitis B and C. Now, these are individuals who are for example, the healthcare individuals who are in contact with patients who are infected with these viruses, and the infants of the infected mothers are also at high risk, and hemodialysis patients are at high risk, and those patients who share needles and syringes with each other during drug abuse are at high risk. So these are some of the patients who are at high risk for developing hepatitis B and C viruses.
How do I know if I have hepatitis B or hepatitis C?
Now, hepatitis B and C can have varied symptoms. Sometimes the symptoms may be negligible, they may be asymptomatic, that is the patient may not have any symptoms, or sometimes they may have symptoms with complications with jaundice, and therefore it is very important to do certain tests which will give you, which will let you know whether you have hepatitis B or C. For example, for hepatitis B, there are certain simple tests like the antigen tests, which are kit-based tests. These can be used to detect hepatitis B and C. And these tests should be done in those individuals who are at risk of developing this disease.
What precautions can you take to prevent hepatitis B or hepatitis C virus?
Now, in order to prevent the hepatitis B and C virus, one should avoid contact with infected blood or blood products or the body fluids. So therefore, you need to have safe sex, and you should not share needles, syringes with other infected persons. You should not share razors and toothbrushes, and you have to be careful while delivering an infected woman with hepatitis B or C virus. Immunoglobulin is one preventive measure for the newborn child, which can be given at the time of birth in order to prevent the transmission. And of course, the children, all children should be immunized by giving hepatitis B vaccination.
Can I get protected against hepatitis B or hepatitis C virus?
Yes, it is important that we protect ourselves, and protection can be done through all the precautions that I have mentioned about avoiding the contact with the blood and the body fluids, and through proper immunization. Now, for hepatitis B, immunization is available, but for hepatitis C, the immunization is not there, the vaccine is not available. Therefore, all the precautions need to be very carefully followed in case of hepatitis C infection.
Is there a cure for hepatitis B or hepatitis C virus?
For hepatitis B virus, there are a lot of good treatment, antiviral drugs and interferons which are now available that can slow down the virus, or they can reduce the damage which has been done to the liver. And in a very few cases, the virus can also be completely removed from the body or from the liver. However, for hepatitis C, a complete cure can be achieved by giving certain medications, and therefore they can achieve long-term suppression from the viruses. Patients who have hepatitis B or hepatitis C infection should undergo regular checkup with the treating physician, and they should avoid certain drugs like alcohol. For example, hepatitis C, if they take alcohol, the disease progresses faster. And also they should avoid all kinds of over-the-counter prescription pills and drugs that has the potential to damage the liver.
Should hepatitis B or hepatitis C infected person be restricted from working in certain occupation or settings?
In general, patients with hepatitis B and C, as long as they don't come in body contact with blood or blood fluids, body fluids such as semen or saliva, are safe to do any kind of profession like school work, office work, or any kind of work that does not involve contact with blood or blood products. They can lead normal lives as normal people do, as long as they take care of their physical health.
After all, your final message for all the patients having hepatitis B or hepatitis C infection?
My final message to all patients with hepatitis B and C is that they should be in constant touch with the treating physician regarding any new symptoms or any side effect of the treatments they get. And in those patients who are at risk should undergo treatment or screening, regular screening, in order to find out if they have the disease, and if they do not have the disease, they should undergo proper vaccination in the proper time, especially with hepatitis B virus.